Yeah, so we know that there's a number of cases still being identified by the CDC across multiple states. My understanding is we're actually up to about 75 cases across the entire US with 13 different states involved. Here in Utah, we haven't been hit very hard, happily. We've only had 4 cases, but we know our neighbor Colorado has had quite a few cases, so we certainly are on the alert to make sure we don't have more that just have sort of not been detected yet. E. coli infections are not rare. We definitely see a number of people get this infection every year. And it is one of these infections where, depending on who you are, the risk is very different. So the people at highest risk are going to be the little kids and the older adults. E. coli infections in most people will appear very rapidly after they've consumed the food, but it does depend on exactly how much E. coli was in the food they ate and what kind of food they ate. Classically, we think of it, people getting sick from this in the sort of day after they have been exposed to the food. Some people, however, it can take a number of days, and it could take up to a week till they see symptoms. Many people will be sick with an E. coli illness for 3 to 5 days. Often it will just pass through, but some people do need additional medical attention. E. coli does die with cooking, but we do know that there's often times where cooking is not sufficient. Quite often we see that these outbreaks are due to some other part of the meal, and specifically in this case right now, the data suggests that it's actually from the onions that were put on to the quarter pounder. Yeah, certainly the simple actions are really important. I know your mother told you to wash your hands. My mother certainly did, and they are right. Washing hands is such an important action to keep us all healthy and safe. We know a lot of bacteria are transmitted on our hands, and it's easy to forget to do it, and it's a simple step that will keep us all a little healthier.